The World Health Organization reports that approximately 1 in 3 adults globally is at risk of developing chronic kidney disease, a progressive condition characterized by the gradual loss of kidney function. This eye-opening statistic highlights how widespread CKD is and emphasizes the importance of taking proactive steps to prevent its development. By encouraging healthy lifestyle choices and regular screenings, lower the chances of CKD and promote better kidney health worldwide. To create an effective care plan, it's crucial to assess the patient's stage of CKD, customizing the approach based on their individual needs. This means closely examining each patient's unique circumstances and tailoring approaches accordingly. This personalized approach ensures that the care plan is not generic, but truly represents the wide range of ways CKD can manifest in different individuals. The initial step involves conducting a comprehensive assessment, which includes looking into the patient's medical history, conducting thorough physical examinations, and working collaboratively with the entire healthcare team. This approach ensures a detailed understanding of the patient's overall health and specific conditions is acquired, laying the foundation for a customized and effective care plan. Crafting individualized care goals involves close collaboration with healthcare professionals, ensuring personalized objectives aligned with each patient's unique needs. Setting realistic goals in collaboration with specialists ensures a comprehensive approach that addresses symptoms and underlying factors, emphasizing the commitment to patient-centered and effective healthcare interventions. In healthcare, medication management is crucial for nurses. They don't just distribute pills, they act as educators, sharing knowledge to help patients understand their medications. Nurses go beyond exploring potential side effects, navigating pharmaceutical nuances, and emphasizing the importance of adherence. Beyond routine medication administration, nurses foster patient understanding through open communication and a patient-centered approach. They simplify the world of medications, empowering individuals to actively participate in their healthcare journey. As healthcare educators, nurses advocate for patients, ensuring they understand the importance of following prescribed regimens. Each pill is highlighted as a step towards better health and an essential aspect of overall well-being. Dietary management is crucial, involving a detailed plan with dietary restrictions, fluid monitoring, and collaboration with dietitians. This approach enhances understanding of the link between nutrition and overall health, guiding patients' dietary choices and deepening comprehension of intricate connections between nutrition and overall well-being. Dietary restrictions are meticulously customized, considering individual health considerations and preferences, ensuring the nutrition plan aligns seamlessly with each patient's unique health goals. Recognizing the critical role of fluid intake in kidney health, its importance is emphasized. Regular assessments and transparent communication establish a partnership with the patient, emphasizing the significance of maintaining a balanced fluid intake personalized to their specific medical needs. Collaborating with dietitians enhances the care strategy, tailoring dietary plans to meet nutritional requirements and align with the patient's lifestyle. This collaborative effort reinforces the patient's active role in shaping their dietary choices, empowering them in their healthcare journey. Managing symptoms is a crucial part of the care strategy, involving addressing symptoms such as fatigue, nausea, and pain to enhance the patient's overall quality of life. This approach integrates personalized interventions to meet individual needs effectively. In symptom management, you go beyond administering treatments to actively engage in patient education, providing insights into the nature of symptoms, potential triggers, and available interventions empowers patients to be active participants in their own care. This educational aspect enhances comprehension of symptomatology and provides individuals with resources to make well-informed decisions about their well-being. The commitment to symptom management extends beyond immediate relief, aiming for a holistic improvement in the overall experience and quality of life for the patient. Regular monitoring and evaluation play an essential role in tracking the progress of a patient's health. This involves conducting regular checkups, performing necessary lab tests, and maintaining open communication with the patient. Through this proactive approach to care, healthcare professionals can promptly identify any changes or developments in the patient's condition, enabling timely adjustments to the care plan. Routine assessments serve as valuable touchpoints, providing insights into the effectiveness of the interventions and guiding the ongoing management of the patient's health. By staying vigilant and engaged through constant monitoring and evaluation, Healthcare providers can address emerging issues promptly and ensure that the care plan evolves in response to the changing needs of the patient, ultimately contributing to a more proactive and personalized healthcare experience. In conclusion, a complete nursing care plan for chronic kidney disease involves assessing the patient's stage, setting personalized goals, managing medications, implementing dietary strategies, addressing symptoms, and continuously monitoring and evaluating progress. By understanding each patient's unique needs and working collaboratively with the healthcare team, you contribute significantly to their journey towards better kidney health, providing positive outcomes and enhancing overall well-being. Hey, if you found this video helpful, be sure to hit the like button and subscribe to our channel for more kidney health tips and advice. Check out our video called How to Support a Loved One with Kidney Disease. By subscribing, liking, and exploring our playlist, you'll stay connected and well informed on all things related to kidney health.